Hi friends, in this video we will discuss the part 2 of the question paper that is held on 2015. So the question number 25, arterial blood gas result showing pH 7.45 and PCO2 30 and HCO3 22 can be interpreted as the given options are normal, respiratory alkalosis compensated, respiratory alkalosis, respiratory acidosis compensated. So the correct answer is option B, that is respiratory alkalosis compensated. Question number 26. While caring patient with DVT, which among the following is most suitable? Options are out of bed activities as desired, bed rest with affected extremity flat, bed rest with the elevation of the affected extremity, bed rest with the affected extremity in a dependent position. The correct answer is option C, that is bed rest with the elevation of the affected extremity. Question number 27. A nurse is caring for a patient with a chest tube. Accidentally, the tube got disconnected. What will the nurse do first? Options are call the physician, place the tube in a bottle of sterile water, immediately replace the chest tube system, place a sterile dressing over the disconnection site. The correct answer is option D, that is place a sterile dressing over the disconnected site. Question number 28. On detecting the transfusion reaction, the most significant action to be performed by the nurse is given options are send a fresh sample of the patient's blood to the blood bank. The given options are send a fresh sample of the patient's blood to the blood bank, place the patient in propped up position, start a new IV line and remove the existing line, start oxygen. The correct answer is option A, that is send a fresh sample of the patient's blood to the blood bank. Question number 29. A patient is brought to OPD with diabetes ketoacidosis. In the acute phase, the priority action is to option A, administer sodium bicarbonate. Option B, administer 50% glucose IV. Option C, administer insulin IV. Option D, monitor the ECG. The correct answer is option C, that is administer insulin IV. Question number 30. A patient is in sinus bradycardia with heart rate 45 beats per minute, complaining dizziness. His BP is 80/60. Which of the following should be the priority intervention? Options are option A, defibrillation. Option B, administer. Option C, continue monitor. Option D, prepare for transcutaneous pacing. The correct answer is option D, that is prepare for transcutaneous pacing. Next question. When a patient is on continuous bladder drainage, the bag should not be raised above the hip level because the given options are because the bag may fall down, because catheter may be pulled out, to avoid return flow of urine into the urinary bladder, because it may cause bleeding. The correct answer is option C, that is to avoid return flow of urine to the urinary bladder. Next question. Broca's aphasia refers to options are inability to understand spoken language, fluent nonsensical speech, fluent speech, inability to express ideas. The correct answer is option D, that is inability to express ideas. Next question. Fever, headache and knuckle rigidity are classic symptoms in options are raised intracranial pressure, Alzheimer's disease, brain abscess, meningitis. The correct answer is option D, meningitis. Question number 34. The region of brain which is responsible for higher mental functions and decision making is located in option A, parietal lobe, B, temporal lobe, C, occipital lobe, B, D, frontal lobe. The correct answer is option D, frontal lobe. Question number 35. Diagnosis of pulmonary embolism is confirmed by option A, positive troponin T, option B, positive pro-BNP, option C, positive D-dimer, option D, characteristic ECG. The correct answer is option C, that is positive D-dimer. Question number 36. After clamping the umbilical cord, the newborn starts to breathe in 5 minutes, 3 minutes, less than 30 seconds, 1 minute. The correct answer is option D, that is 1 minute. Question number 37. ORS solution doesn't contain. Options are sodium chloride, potassium chloride, magnesium sulfate, sodium bicarbonate. The correct answer is option C, that is magnesium sulfate. Question number 38. The word cold chain is the process used for option A, prevention of fever, B, streptococcal prophylaxis, C, prevention of VAP, D, preservation of vaccine. The correct answer is option D, that is preservation of vaccine. Question number 39. Welle's rule of 9 denotes option A, 9 ways of assessment of arterial blood gas, B, assessment of the severity of burns, C, standard management of shock, D, systematic assessment of stroke. The correct answer is option B, that is assessment of severity of burn. Question number 40. Normal daily requirement of sodium for an adult. Option A, 10 to 15 gram. Option B, 20 to 25 gram. Option C, 80 to 120 gram. Option D, 2 to 4 gram. The correct answer is option A, that is 10 to 15 gram. Question number 41. Which of the following is not a cardiac supportive device? Option A, intra-aortic balloon pump. Option B, cardiopulmonary bypass. Option C, pacemaker. Option D, Holter monitoring. The correct answer is option D, that is Holter monitoring. Question number 42. What is pulse pressure? Option A, difference between apical and distal pulse. B, difference between pulmonary and aortic pressure. C, difference between systolic and diastolic pressure. D, difference between jugular venous pressure and left atrial pressure. Correct answer is C, difference between systolic and diastolic pressure is termed as pulse pressure. Question number 43. The antidote for heparin is option A, desmopressin, B, protamine sulfate, C, nedriparin, D, warfarin. The correct answer is B, protamine sulfate. Question number 44. When ventricular fibrillation occurs, the first action to be initiated is A, administer oxygen, B, defibrillate the patient, C, initiate CPCR, D, prop up the patient. Correct answer is B, defibrillate the patient. Question number 45. Which of the following is an antiarrhythmic drug? Option A, alteplase, B, amlodipine, C, amiodarone, D, atropine. The correct answer is option C, amiodarone. Question number 46. Which artery supplies blood to the anterior wall of the heart? Option A, circumflex artery. Option B, internal mammary artery. Option C, left anterior descending artery. Option D, right coronary artery. The correct answer is option C, left anterior descending artery. Question number 47. Recommended practice of collecting sample for culture and sensitivity from an indwelling urinary catheter is. Given options are A. Pour from the urobag, B. Disconnect catheter and collect, C. Recatheterize and collect urine, D. Aspirate with a sterile syringe and needle. The correct answer is option D. Aspirate with a sterile syringe and needle. Question number 48. WHO evolved DOTS for the effective control of option A. Leprosy, B. Tuberculosis, C. Poliomyelitis, D. Malaria. The correct answer is B. Tuberculosis. Question number 49. Apgar score of a normal healthy newborn baby is. Options are A. 5 to 6, B. 6 to 8, C. 3 to 5, D. 8 to 10. The correct answer is option D, that is 8 to 10. Question number 50. A device that translates one form of energy to another is. Options are A. Transducer, B. Manometer, C. Barometer, D. Inverter. The correct answer is option A. Transducer. So we have discussed 50 questions. Again 30 questions are remaining. That questions we will discuss in part 3 video. Please support and subscribe the channel for more questions. Thank you.